Thanks for having me today. I actually changed the title of my talk from Disruptive Innovation in Pharma to Accelerating Actionable Innovation. And primarily because I think you'd all agree that there's a ton of buzzwords out there, especially in the innovation industry. So I wanted to focus this talk on how can we make innovation actionable. Also, how can we accelerate innovation? Pharma has done a ton of good work around innovation already. I'm sure some of these trends, like going beyond the pill, is already top of your agenda. So it's not about starting from the beginning. It's about taking innovation, accelerating it, and of course, focus on actionability. What's interesting about innovation is when you ask top pharma CEOs, in fact, this survey came out with 1,400 life science and pharma CEOs, their number one challenge is really understanding the value and impact that innovation brings to their organization. So I kind of use this kind of key learning that I found to guide today's conversation. So really, what are the questions? If hopefully we'll have time for all of them. The first one is, how can you identify more growth opportunities and accelerate actionable ideas? I'll share two tools that we've used in the Innovation Lab to drive roughly 800 ideas in about a month. Once you have these ideas, how can you manage them? How can you manage an innovation portfolio focused on speed? How can you organize yourself to support innovation? Every organization is going to be different with the way they think about innovation. There's different structures that one could leverage. And lastly, how can you measure the success and value of your innovation investment? So fairly pragmatic topics today. If you hear me using any buzzwords, just throw something at me. Won't be the first time. So the first thing that we like to do is really redefine what innovation is. When I talk with a lot of people, a lot of focus is on new products, launching new products, new services, and sometimes innovation around core process within the organization. Those, of course, are definitely what innovation is all about. But there's other areas of innovations that we see in the industry. You could have system innovations where you take your existing set of products and put them together in a new and unique way to give you a differentiated advantage. Customer service innovations. Think of Enterprise Rent-A-Car. They started the model of "We'll pick you up." That was both a customer service innovation as well as a channel innovation, delivering the products you currently have in a new way. Right? Doesn't have to be all about new products. And of course, brand innovation. You think of the Virgin brand and the strong innovation they have there, customer experience, business model, and network innovations. How can you work with your current stakeholders today in a different way, in a more unique way? Think of the Walmarts of the world, for example, the Targets of the world as well. So I want to kind of give you guys two examples, which I found very interesting. First one has to do around wine. So imagine you get invited to your boss's house for some dinner, and your boss is an enophile connoisseur. He or she loves wine. Now, if you're like me, you know just enough about wine to be dangerous. So how do you go about picking the right pair of wine? You might ask, what's for dinner? So let's say it's chicken. You probably Google it, or you go to the LCBO and you trust a 25-year-old part-time employee to help you out there. Now, there's a neat company called Bottle Rocket, and what they've done is they've reorganized their store around the pairings of the wines. So if you're having seafood, is it fatty fish? They have recommendations on the wine. Is it poultry? They even have a gift section, and you see here it says for the boss, right? They even have wines for third dates if you're cooking for your third date. So this is an example of somebody having probably the exact same products as their competitors have, right? But this is a channel innovation, showing your products to the market in a different and unique kind of way. Another interesting example is in the travel industry. So today, if we want to buy tickets, we either go to our agent or most likely go online with some of these providers. Now, there's a startup company that realized that people overpay roughly $100 billion on their tickets, because what ends up happening is after you purchase your tickets, typically the price goes down, right? So what these guys do is you purchase your ticket through them, and they'll track the price of that ticket. And if the price drops below a certain point, they'll automatically rebook you on the same flight, same time, same seat, and give you the cost savings. right? So this is an example of a unique business model innovation, so doing business in slightly different ways. So I find that when I showcase this kind of these 10 dimensions of innovations when we run workshops, just the nature of saying that it goes beyond product and service and processes really opens people's minds up, and you get a ton of great ideas. And another thing about that previous slide is it allows you to also evaluate how strong an idea is. So is it just a new product, or is it a new product with a new business model that's going to leverage a new channel innovation as well? So the more dimensions of those kind of innovations you can get into the process, the stronger the idea is. Another tool we use is called reframing. So reframing is all about finding the answer within the problem. So we all know that customers' unmet needs and pain points are very, very important. And what reframing strives to do is to take, instead of the ready, fire, aim mentality we typically have, where we have a problem and we jump straight to the solution, it spends a lot of time trying to understand what the problem really is, trying to reframe the problem in multiple ways to come up with different solutions. So let me give you an example, something that we're doing in the innovation lab. So low adherence, patients with skin conditions, depending which condition, could have 5% adherence or medical compliance rates, right? So the typical solution would be patient education, patient empowerment, all good ideas. And now we're starting to see apps that send automated medical reminders, right? It's time to take your pill, so on and so forth. But when you look at what causes low adherence, when you try to reframe the problem, patients often tell you that there's a lack of a personal bond. This model of take this pill, see you in 6 months, just doesn't work for them, right? And that allows you to come up with solutions like remote follow-up. So we now have a teledermatology app where patients can once a week follow up with their physician, and we're seeing amazing increases in adherence because it's called white coat compliance, right? The reason why we all brush our teeth before we go to the dentist, right? Also, frustration with the slow healing process. A lot of patients take their medication, they don't see improvement, so they either give up or try to do something else. You can build a progress tracker and a visualization tool. One thing we're doing is we have now a tool that you can take a picture of your skin once a day, and it tells you, hey, you may not be seeing a difference, but you're getting 4% better over yesterday. Keep this up, next Tuesday your flare-up is going to be gone. And lastly, there's the image of self as a patient. Psychology, self-image is extremely important in adherence. So looking at solutions with rich imageries, positive emotions. So the point of this slide is that jumping straight to a solution in kind of that rapid fire way, could be supplemented with really focusing a lot of time on understanding really what is the problem. So once you have all these ideas, how do you manage them, right? Because if you mismanage them, ideas will just not go anywhere, and they'll lose a lot of traction. So really every idea, 3 questions. Is there a need? Can we deliver it? And is it worth it for the company? And there's really a spectrum to the answers here, right? So is there a need? Is this something that the patient said? Have you observed there's actually a need with the patient? Have they used it? Have they purchased? Have they repeated purchased? And have they advocated for it? Same for can we deliver it, right? Is this something you just dreamed up? Do you have a drawing? Have you prototyped? Have you piloted? So on and so forth. And lastly, is it worth it? Have we done a back of the envelope calculation? Have we walked through the transaction, the business model? And the thing is that every idea can be mapped along this matrix. And based on where the idea is, there's different things you can do to kind of keep pushing it forward. And typically, you see a lot of the green circles. Those are things you can do in hours, right? They shouldn't take days or years around certain types of innovations. So how do you organize for innovations? In my last minute here, organizing the kind of innovation initiatives really depends on what the challenges of the organization is. If it's an organization that is struggling with driving ideas that drive growth, or feel that there's low awareness or knowledge of outside perspective, then typically use a SWAT team approach where you have some innovation experts going to project-based teams to help foster their innovation. If it's not about the ideas, hey, we have 800 ideas, but they're losing traction, right? Then it's about growth accelerators. So having leadership teams dedicate time, either an investment fund, a seed fund within the corporation. GE does an amazing job with that. If it's about, hey, we have ideas, they're moving forward, but they're just not driving a sustainable business, they're not translating into commercialization, that's about creating innovation labs, right? These are dedicated incubators. It's a group that's focused on commercializing these ideas. Shell does a great job. And what Leo Innovation Lab decided to do is launching a spin-off. So this is a completely separate entity from the core business that's fully autonomous, that has both BD and venture capital capabilities that can not just drive ideas and build prototypes and make them into businesses, but also scale up the businesses on a global basis. Now, whichever one of these structures you choose, of course, is very much dependent on the level of resourcing you have and also on the autonomy you provide the innovation initiative. So I'm just going to skip this because I'm out of time, but measuring innovation, really, you want to measure innovation not just on the outputs, but across the pipeline. So I've got 10 metrics here that we use to make sure that we're driving innovation. Both the inputs, things like how many dedicated resources do we have, how many number of ideas or concepts have we generated, number of prototypes we build, but also on the process, how fast is it from an idea to prototype? What's the idea breadth? So are we driving 100% of the ideas, or are 20% of the ideas coming from the customers, 10% from competitors, 30% internally? Having this mix of ideas is very important. And lastly, how's our innovation portfolio doing? Are most of the ideas very early stage? Are they not progressing through the pipeline? And of course, the output, the impact on the patient. At the Leo Innovation Lab, we measure this very closely. We just partnered up with the World Happiness Index to measure the happiness level of psoriasis patients all over the world. And we track this every month on how we're doing when we're launching our innovations, number of solutions we've launched, number of new categories, and so on and so forth. So I think that brings me to the end of my, my talk. Hopefully that was fairly actionable and some kind of pragmatic examples. And I'll just leave you guys with this innovation bingo. Next time you're in an innovation meeting and people start throwing out buzzwords, see how many times you can yell bingo. Thank you very much.